Hi, and welcome viewers of Nursing Academy 101. In this video, we will talk about nursing medical surgical, infectious diseases, multiple choice questions and answers, part 2. But before we start, please don't forget to subscribe, like and share the channel to encourage us to continue and provide you with all in you. Question number 1. Bobby, 3 years old, from a family of 4 old siblings, a mother and a father, was admitted to the hospital with a temperature of 101 Fahrenheit, a sore throat of 4 days duration, with difficulty of swallowing, and a moderate cervical adenitis. A diagnosis of pharyngeal diphtheria was made. The best means for providing complete bed rest for the child include A. Feeding the patient, B. Giving sedation, C. Providing quiet diversion, D. Giving complete physical care. The answer is B. Giving sedation. Question number 2. A positive nose and throat culture in a member of the family in whom no sign of the disease are present would indicate A. That he is developing diphtheria, B. That he is a carrier, C. That he is susceptible to diphtheria, D. That he is immune to diphtheria. The answer is B. That he is a carrier. Question number 3. All of the following are true of diphtheria except A. Complications may include damage to heart or kidneys. B. It's readily treated with antibiotics. C. Symptoms include the formation of a tough grayish membrane in the throat. D. It's prevented by immunization with diphtheria toxoid. The answer is B. It's readily treated with antibiotics. Question number 4. Pertussis is characterized by A. Fluid accumulation in alveoli, B. A whooping type cough, C. Calcification of lung tissue and acid-fast bacteria, D. A tough grayish membrane formed in the throat. The answer is B. A whooping type cough. Question number 5. The terminology DTaP immunization is for A. Dermatomycosis, TB, pertussis, B. Diphtheria, TB, pneumococcal pneumonia, C. Diphtheria, tetanus, pertussis, D. Diphtheria, tetanus, parainfluenza. The answer is C. Diphtheria, tetanus, pertussis. Question number 6. Charles, an 8 years old boy, one of several siblings in the family, is kept home by his mother because he has a temperature of 100.2 Fahrenheit and a history of hacking cough for 2 weeks. A definitive whoop has been heard and the doctor made a diagnosis of whooping cough. The visiting nurse is instructed the mother in proper care of this patient. This young boy should be A. Kept in warm dry room, B. Placed in a sunny room, C. Kept in a room with a temperature of 60 Fahrenheit, D. Allowed free run of the house. The answer is A. Kept in warm dry room. Question number 7. The organism causing whooping cough is A. Hemolytic streptococcus, B. Haemophilus influenza, C. Haemophilus pertussis, D. Streptococcus albus. The answer is C. Haemophilus pertussis. Question number 8. Whooping cough is most contagious A. In the paroxysmal stage, B. In the catarrhal stage, C. In the febrile stage, D. In the incubation stage. The answer is B. in the catarrhal stage. Question number 9. During the second stage of the disease, the characteristics paroxysm is frequently accompanied by A. Involuntary micturition, B. Spontaneous epistaxis, C. Inspiratory whooping, D. Expulsion of mucus from the trachea. The answer is C. Inspiratory whoop. Question number 10. The diagnosis of pertussis is confirmed by which of the following tests? A. Nose and throat culture, B. Nasopharyngeal culture, C. Rapid culture of nose and throat organism, D. Sputum culture. The answer is A. Nose and throat culture. Question number 11. Oxygen is used in whoop cough for which of the following reasons? A. Prevents the pertussis organism from multiplying. B. Seems to lessen the occurrence of paroxysms. C. Reduce the danger of convulsions. D. Prevents atelectasis. The answer is B. Seems to lessen the occurrence of paroxysms. Question number 12. Sami, 43 years old sailor, who is referred from a psychiatric department to rule out the possibility of trypanosomiasis because of erratic behavior with neurological symptoms and the notion of a stay in Africa in his past. African trypanosomiasis disease is caused by Trypanosoma brucei, B. Clostridium prion, C. Streptococcus brucei, D. Trypanosoma prion. The answer is A. Trypanosoma brucei. Question number 13. African trypanosomiasis disease is also known as A. African herpes simplex virus, B. African viruses meningitis, C. African neonatal meningitis, D. African sleeping sickness. The answer is D. African sleeping sickness. Question number 14. Vector that transmit African trypanosomiasis disease is called A. tsetse, B. tick, C. lice, D. mother to child. The answer is A. tsetse. Question number 15. What organ is targeted during an infection with African trypanosomiasis disease? A. Heart, B. Brain, C. Liver, D. Spleen. The answer is B. Brain. Question number 16. As the parasite in African trypanosomiasis disease enter through both the blood and lymph system, often swell up to tremendous sizes. A. Lymphatic system, B. Lymph node, C. Immune system, D. Spleen. The answer is B. Lymph node. Question number 17. When African trypanosomiasis disease then enters a neurological phase when the parasite passes through the slash. A. Meningitis, B. AIDS, C. Blood-brain barrier, D. Immune system. The answer is C. Blood-brain barrier. Question number 18. Which method is best for controlling African trypanosomiasis? A. Vector control, B. Vaccination, C. Antibiotics, D. Avoid swimming in contaminated water, E. Avoid reservoirs. The answer is A. Vector control.